지역을 좀 옮겨서 캐나다의 연구 질성의 상황은 어떤가 하는 것을 들어보도록 하겠습니다. Please.
Thank you very much. I wouldn't be so bold as to translate anything into any other language because I'm deficient in all of them. Perhaps even English, as you might come to appreciate. What I'd like to do today is to walk you through the Canadian experience, and I'm going to try to paint a picture of what we were dealing with in Canada when the research integrity issue rose to the national level, and walk you through the report, the expert panel report that was produced, so that you have some context of where we started with this, where we ended up, and there's been reference made earlier. Michael made a reference made to our expert panel report, but I think it is instructive to, get to the underpinnings of the discussions from that expert panel to maybe provide you with some of the earlier thinking when we were wrestling with the questions that were asked of us. Just to let you know, indeed Canada is north of the U.S., though I've had several discussions here pointing out to people in the U.S. that some parts of it are actually south of the U.S. border. The climate there is pretty much what it is here today in the southernmost reaches of Canada. I won't speak for the rest of the country, which is going into a deep freeze. Let me move forward. Really this is, my talk is talking about the expert panel report that was produced in 2010. But I think both the lessons learned from that as well as the report itself, which is available, and I'll come to that later, available through the Canadian Council of Academies, but also available on the internet if you just Google it. It will be available to you, and I think it is a thoughtful piece of work that can contribute to the overall discussion in research integrity. So when we first got together as an expert panel, we were starting to talk about research integrity, and many of the things you've heard this morning and this afternoon already, we will echo some of those. But we had a specific charge. But before getting to that charge, we really felt that research is vital, not only for researchers and advancement in different areas of science, but also in public policy and economic agendas. So a lot of people place their faith in the results of research, and we don't want them to place their faith blindly, so that we need to be highly responsible for what we do. Innovation and overall progress is dependent upon the results of research, and people make big decisions based on what researchers are telling them. And in order to do this well, trust is vital. We can't have the public starting to question a lot of the research results that we're actually standing behind. So we need to take bold steps to make sure that we can move forward in a way that is highly responsible. And failure of the system to support the integrity enterprise threatens the progress in many areas of societal development, from social sciences to medicine to fine arts for that matter. There's a lot of things that are relying on different forms of research, and that's what we're trying to work with here. So how significant of the problem was the problem? And I should say the expert panel, just to describe them a little bit, were people from a lot of either senior researchers or senior administrators, such as VPs research at various universities, were making up this panel. And so the first question we are asking ourselves, and you'll see why in a minute, is that why are we here? And what, by the way, is research integrity or lack thereof? In our deliberations, we thought it was very difficult, and it depended upon the definition of what misconduct is. There are a variety of definitions out there, and we could either adopt them or look towards refining that definition in our, in our Canadian context. The, how difficult, how big a problem is it? Well, that turns out we really didn't know. And there's lots of reasons behind that. But here are some estimates. BMJ editor at the time was talking about 20 cases a year that they were seeing. This Ransdam surveyed biostatisticians and found that about 31% had been involved in projects with misconduct, which seems very high from this survey. Another survey looked at medical consultants and found that 56% had observed misconduct. Only 5.7% had actually committed it, misconduct, and 18% may commit it in the future. Again, there's a common trend running through a lot of these surveys that that they've all have much higher percentages of having observed it firsthand, and but of course it didn't apply to them, which is what we see on a regular basis. So another example where about 1% had misrepresented their research, 5% had fabricated data over the last 10 years, but 17% knew of others that had. So again, it is in the perception is much more about other people than it is about yourselves, and we have to work out ways to really instill this kind of appropriate research behavior in our investigators. This may be wrong, but it was the number we had at the time, that about 20 cases per year at ORI were resulting in findings. Some estimates reached as high as a couple of thousand a year on a global basis. So this is not a small problem, and it's much more of a problem than anybody in research and science would really like to see or have publicized. Lots of reasons that lead to poor detection of misconduct. For instance, the lack of replication of findings or the lack of reporting of those findings. Often people suspect others of misconduct but fail to report for all of the obvious reasons from colleagues. Journals, we talked about this a little bit earlier. The first speaker this morning in the first keynote talked about misconduct and what journals could do better. And institutions fail for a variety of reasons to carry out investigations. And both what you heard from John in the US is that ORI is a second level investigation. If it never gets out of the first level, it doesn't go any further. You know, is a breach of research integrity important? And I won't go through all of these examples because we've heard from better qualified people than I am to discuss firsthand some of these. So I'll talk about just some of the examples. A bit of a dated example is William Summerlin from Sloan Kettering in the US, the Cancer Center, a dermatologist, saying that he has transplanted human corneas into rabbits. And he did this by virtue of a culture that he created, and he said that he could actually turn or transplant these skin specimens into black mice from white mice. Neither claim was true, and the black spots that were indicated, not like the blots quite, but a bit more primitive than that, were colored in with a black pen. And again, a theme that we heard a little bit earlier is that mental exhaustion might have been, that was the excuse used at the time, and that was appropriate, and decisions were based on that. I'm not saying it was appropriate, but decisions were based on that, and he went on to practice medicine elsewhere. This I won't go through because you've heard some brilliant communication on this case. I'll reserve some of my comments for the Canadian context and give you some information that we are not, we share in the concern over research integrity and misconduct because we've had it in our own backyard as well. But here's an interesting one. Jean Sudbo was a dentist and consulting psychologist or consulting oncologist in the area of oral cancers. In 2005, seems like this this year keeps on coming up. There must have been something in the water. He was being considered for position as chief scientist of Norway. due to his influential papers in the New England Journal, the Lancet, BMJ, and others, highly prestigious journals. And his theory and the evidence he was providing was talking about non-COX-2 NSAIDs, such as ibuprofen, reducing the risk of oral cancers in smokers. And this was getting a lot of traction. And one point that was raised earlier is, what is the harm? Is there no victim here? If you can convince smokers that if they take ibuprofen on a regular basis, their cancer risk is lowered, there's a huge societal harm. And someone should do an economic analysis of something like that. Of the 38 papers he published from 1993, 15 were fraudulent, including his doctoral thesis. And the way that was discovered was that there were 908 cases in his pivotal study, of which 250 had exactly the same birthday. And that's how it was discovered. People looked at the raw data, so it seems unlikely these were different people, but fabricated people. He lost his professional licenses, but this turned out to be only for a short period of time, and he got his professional licenses back. I won't go through this because John already went through the Perlman case. Again, this is probably the most severe penalty that has been given to investigators for misconduct. But I think the important point here, it was for the financial issue and not for the misconduct issue was what the penalty was issued for. And of course, he went to Vermont after that. We had a couple of cases in Canada. The Ranjit Chandri case from Memorial University in Newfoundland. He had published a multivitamin formula that would reverse memory problems. I used to say in the elderly, but somehow at my age it doesn't, I'm going to come up with a different word for that because over 65 is not elderly. At least I'm going with that for now. And it had all the hallmarks of being invented. To support this work, he cited articles in his own journal replicating the finding, of which he was an author. And based on the media coverage and scientists starting digging into it, they were very much confirmed that basically all of these data were fabricated. As this was moving forward, he decided to retire from Memorial and return to his home in India, never to be heard from much again. Although I'm sure there's things going on there. When we were conducting and going through this annual report, we also had, we were in our final stages of finalizing the report from the expert panel, and then this case hit the media in Canada. This was Daniel Kwok from the University of Alberta. He received doing nanotechnology work. NSERC is a funding agency within Canada, and received a lot of money for this. There were allegations of plagiarism and misuse of grant funds. And he was accused of spending up to $150,000 in grant money on home entertainment systems, car parts, a boat apparently as part of that as well. And but the NSERC investigation, again, an ethical issue on a different level to be concerned about, took about 4 years. In the meantime, he went from one university in the province of Alberta, in Edmonton at the University of Alberta, to the University of Calgary. University of Alberta failed to reveal anything about this case and about the ongoing investigation. So University of Calgary arranged for him to get a $500,000 Canada Research Chair and $1 million new lab. And in 2010, he was banned indefinitely from receiving NSERC funding. Again, the penalty was on the basis of the funding, not the misconduct and the fraudulent data. Let me skip this. In Canada, we have 3 major granting councils, and these are collectively known as the Tri-Council Group. And they provide the majority of the funding, with Institutes of Health Research providing the vast majority of the funding for medical research, and the others covering off other areas of research. And they all have policies on research integrity, as do some of the professional associations. So in terms of where we were in research integrity. The original Tri-Council policy statement talked about it when it was first formed. There were revisions to it in 2005 and 2008. And then there was an independent consulting group did a report on this as well, commissioned by the federal government. And what this independent consulting group found is that we don't have a harmonized system or common research misconduct policies. It's really a hub and spoke wheel, a spoke model for funding, and it's all agency dependent. The interpretation of what misconduct was varying from institution to institution and discipline to discipline. And there was no national definition of what misconduct or research integrity was. And that the system needs strengthening. And that served as the basis for the Minister of Industry, and I stress this, the Minister of Industry, not Health, and Education as a provincial matter in the federal government in Canada. Industry gave the Canadian Council of Canadian Academies a directive to look at this issue and a specific charge. The Council of Canadian Academies is an independent science-based expert panel or that creates expert panels to give expert advice on science to the government. And so in 2009, a council was established. It was headed by a former university president, president of several universities in Canada. And he had retired for about a week when they called him up for more service. And he put together this expert panel. And panel's charge was as follows, and some of these, and all of these slides are in your slide deck. Would a uniform definition of research integrity aid the Canadian issue? Is Canada different, or should we align ourselves with emerging global standards? What actions would be considered to constitute research misconduct in the Canadian context? What are the roles and responsibilities of those involved? And how could a common research integrity definition foster a research culture that leads to the highest ethical standards and instills public confidence? That was our charge. And of course, we were not allowed to make up our own questions. We had to answer these questions. So the panel's report on research integrity really heard from all of the stakeholders, underwent a formal peer review report, and I have to tell you that I've never been peer reviewed like this before. We had 14 external peer reviews and from outside of Canada commenting on the report, and we had a vice president of research at the university making sure we listened to all of those comments. So it was intensive. It was released in 2010, and a preliminary report was at the second Research Integrity Council in Singapore. And so it was preliminary at this point because it had yet to be translated into French in Canada, so we can't release anything if that isn't the case. So again, a more detailed analysis is available for you in the report, but we really looked at creating a positive research integrity environment. So less about penalty, more about how can we engage people and instill this kind of approach to research. So we recognize the changing context for research integrity, zero tolerance from the point of view of the public. Privacy legislation is another issue that has to be talked about, and that was a real problem in the University of Alberta case. Overall public confidence or public investments have raised the importance of what taxpayers are paying for, and are they getting value for their money in this context. So we have a non-legislated, decentralized system. Individual institutions are responsible, and guidelines are really guidelines at the federal level. For Canada to strengthen its performance and research integrity, we need the collaboration of everyone and try to engage everyone as part of this solution. We considered practices around the world, the scholarly literature, testimony from all of those that wanted to testify before the expert panel, and the professional expertise of the people on that panel. So we moved to providing a system-wide approach for management, information management and research, and we wanted to create a positive environment that encompasses everybody, creates a common set of definitions, values, and principles, fair and timely process for managing allegations, a centralized mechanism, and a strong focus on proactive and preventative measures. So we ended up looking at the research integrity definition by applying values to it that come from principles at a higher level, with a focus on prevention and promotion and less so on sanction, though we all recognize that that had to be part of the solution. So we defined research integrity in this way as a coherent and consistent applications of values and principles for encouraging and achieving excellence in the search for and dissemination of knowledge. These values, where we ended up, were around honesty, fairness, trust, accountability, and openness. So, and these are the fundamental principles. You can take a look at these because in the interest of time, I want to skip to a couple of other things. But these are reflected, you'll see these reflected in many areas, but I think we were unique in adding some to these, talking about conflicts of interest as well, reporting on research in a responsible and timely fashion, and we had a lot of discussion around acknowledging those people that contributed to that, the uniqueness of that research. And in terms of the FFP, the fabrication, falsification, and plagiarism, we thought we should add to what must be reported as financial misconduct and a disregard of specific professional policies and practices and regulations. If that were the case, that should be part of the misconduct equation. So our main areas of responsibility, we decided that what we really needed is a Canadian Council of Research Integrity, because we have no way of integrating this information at a federal level. So we recognized we didn't know how big the problem was, because there's no central repository for issues like this, unlike, say, there is in the US with the ORI. But we took a little bit different stand in that what we wanted to do was to have this council provide confidential advice to help institutions work through the research integrity issues. We wanted to gather information, disseminate and report that information, and promote best practices. So this was not any sanctions would come from the granting councils that were supporting this work in the first place. So their privileges to apply for research grants would be left up to the granting agencies, but we would be able to, for the first time, get a handle on how big a problem we have, and a promotion or working on promoting best practices. So it was intended to be supportive, a non-threatening environment, and to some extent bridge or fill the key gap in the current system, which is really fragmented and decentralized. I won't go through the details on this because I know I've only got half an hour, but you can see this both in the slide deck that you got as well as in the expert panel report. So we were very specific in terms of the dissemination and reporting of how the Canadian Council of Research Integrity would operate, promotion of best practices. And I'll just say one other word, is that we really tried to get everybody involved in this at all levels so that we would have a positive report for this new area that we were proposing the federal government investigate in. And this is what the recommendation was that went to the Minister of Industry in Ottawa and the Cabinet table following that. Canada, so this is really just an overview, and the Canadian Council of Research Integrity would be this advisory educational body and a repository for the information from around the country. Now, I can say, whoops, I don't know how to go back. I can say, I'll catch up to this slide, that the three major granting councils, the federal government and the major universities in the country all endorsed this report. They thought it was a great report. We should move on this. And that was and then it died out a little bit. So even though you can have great ideas, it's hard to get the inertia behind some of the federal government and granting councils and their administrative bodies to move forward with this. And I'll just make one other statement. We were at the Singapore statement and the World Congress in Singapore on research integrity. And I think there are more similarities than there are differences between the Canadian expert panel report and the Singapore statement. Singapore statement is a bit longer, but I think we landed on a lot of the same issues. These were really two independent kinds of groups, and we were completed our work long before the Second Congress. And I think that's good for some traction, I believe, because we seem to be able to independently come up with what we thought was the best way forward. So I think this is a very good document. It had a lot of thought went into it, a lot of rigor, and a lot of arguments and discussions around that expert panel table. So I just let you know about this activity, the resulting report, but I wanted to place it in context with what we were dealing with, so you can interpret the report in probably a slightly different manner. So with that, I think I've used my time. So thank you very much, and thank you to everyone for inviting me to this great Congress.